Morning, everyone. Our topic for today's discussion is management of Deepbite. We're going to cover the topic under the following headings: introduction, classification, diagnosis, factors to be considered in the treatment of Deepbite, and management of Deepbite. Coming to introduction, the maxillary dental arch being larger than the mandibular arch, which allows the maxillary anteriors to overlap the mandibular anteriors. So the overlapping of the mandibular teeth, it occurs both in horizontal and vertical direction. As we all know, the horizontal overlap is called overjet and the vertical one is called overbite. So from this figure itself, you can make out that the overlap of upper incisor in the vertical direction is termed as overbite, and in horizontal direction, the anteroposterior direction is called overjet. A normal overbite is considered to be 2 to 4 millimeter, which means an overbite greater than 40% is considered abnormal and is considered a deep bite. So in case if your upper incisor covering 40%, more than 40% of your lower incisor, that is considered to be deep bite. So now normal overbite has to be 2 to 4 millimeter. So Graeber has defined deep bite as a condition of excessive overbite where the vertical measurement between the maxillary and mandibular incisal margins is excessive when the mandible is brought into habitual or centric occlusion. Like this is the same as I told earlier, the vertical overlap. In case your there is normal overbite which is 2 to 4 millimeters. So in case if your upper incisor covering more than that of the lower incisor, that is called deep bite. There are so many reasons a deep bite can occur. A deep overbite can be of two types. One is incomplete overbite and the other one is called complete overbite. So incomplete overbite is an incisor relationship in which the lower incisor failed to occlude with either of the upper incisor or the mucosa of the palate when the two teeth are in occlusion. There are two more terms in association with deep bite. One is cover bite. So cover bite is a condition that is characterized by the complete covering of mandibular anteriors by the maxillary anteriors due to excessive overbite and rotoclination of maxillary anteriors, such as class 2 division to malocclusion. You all know how the incisors are positioned in class 2 division to malocclusion. In class 2 division to malocclusion, the upper incisors are retroclined. That means they are inclined in the lingual direction. So what will happen in that case? The amount of overbite increases compared to the normal. So the kind of overbite that happening in this situation, like this scenario, is called cover bite. Another term is closed bite. The closed bite, on the other hand, is a condition where there is excessive overbite as a result of loss of posterior teeth. So, as I told earlier, deep bite can occur mainly, dental deep bite can occur mainly due to two reasons. One is cover bite. Cover bite is the excessive eruption of upper anteriors or lower anteriors. Closed bite is something that deep bite occurs because of the loss of posterior teeth. When there is a loss of posterior teeth, there won't be any occlusion in the posterior aspect. There won't be any molar relation. There won't be any posterior tooth. So in that case, the bite deepens. So closed bite is the deep bite that happens due to missing posteriors, and cover bite is the deep bite that happened because of the excessive eruption of anteriors. Now, the classification. Deep bite can be broadly classified into two. There are skeletal deep bite and dental deep bite. Skeletal deep bite are usually of genetic origin. The kind of deep bite is caused by upward or forward rotation of mandible. There are two kind of deep bites. Like this is a general basic classification. That is, the first one is skeletal deep bite. Skeletal deep bite is a complex actually because there is no dental involvement. It's all because of the skeletal jaw relationship, the jaw position, and the growth pattern. It's all related. So in this figure, you can assess the first figure has to be the normal. The maxilla and mandible planes are in normal position. Then in the second figure, what happened? Maxilla is positioned normal. The maxilla and parietal plane are positioned normal. But the mandible has turned, rotated anti-clockwise direction. The third figure, the maxilla has turned down. That is like in the clockwise direction. The fourth is combination of both B and C. Okay. So this is how a deep bite, skeletal deep bite occurs. When the mandible turns upward, the mandibular teeth also goes up, and that results in deep bite. Same thing happening in the maxillary downward rotation. The maxillary teeth comes down, you get gummy smile, you get deep bite, skeletal deep bite, and that both can occur simultaneously, and that's what's shown in the figure D. So skeletal deep bite is all about that, your jaw position, jaw rotation, and growth pattern. So skeletal deep bites are characterized by presence of following features. They are patient expect a horizontal growth pattern. Horizontal, your growth pattern has to be average growth pattern. It should not be horizontal or vertical. So people who are tall, they tend to have vertical growth pattern. Who are dwarf, they tend to have horizontal growth pattern. In general, I mean, there are so many other criteria too, but in general, this is what actually it look like. So the anterior facial height is reduced in the deep bite case, skeletal deep bite cases, a reduced inter-occlusal clearance. So freeway space is like, you know, the difference between center collision and center occlusion. That's what called freeway space. That is reduced. That has to be 2 to 3 millimeter in the normal cases, but in the skeletal deep bite cases, it is way reduced. A cephalometric examination reveals that most horizontal cephalometric planes, like there are so many planes like SN plane, parietal plane, FH plane, Frankfurt horizontal plane, maxillary plane, mandibular plane. So all these planes are either parallel or converging in skeletal deep bite cases. Okay. Coming to dental deep bite. The kind of deep bite is characterized by the absence of any skeletal complicating feature that are seen in skeletal deep bites. Dental deep bites occur due to over eruption of anteriors or infra-occlusion of molars. So dental deep bite is comparatively simpler. They are not complicated as skeletal deep bite because skeletal deep bite, you know, there are so many limitations for treatment, and there are so many complications. The treatment goes like extraordinary approaches needed. But dental deep bites are just tooth movements, dental movements. So in general, dental deep bite is simple compared to the skeletal deep bite. Deep bite due to over eruption of anteriors. Dental deep bite associated with over eruption of lower incisors is usually seen in class 2 malformation. The presence of increased overjet allows the lower incisor to over erupt until they meet the palatal mucosa. So, you know, there is normal overjet and overbite. That is 2 millimeter of overjet and 2 to 3 millimeter of overbite. But in class 2 condition, whether it can be dental class 2 or skeletal class 2. Okay, we'll take as an examination example of skeletal class 2. In skeletal class 2, you get a lot of overjet. Like it can be more than 5 millimeters, 6 millimeters, like that. Okay. In that cases, your lower incisor has no contact with your upper incisors. Your lower incisors are free to erupt. So these incisors start um, extruding, like they keep over erupting. So that's how the over eruption, like dental deep bite occurs due to over eruption of anteriors. So in class 2 cases, the chances are more. The patient has exhibit a excessive curve of speed. So curvoscopy, you know that it's a smooth curve that passes through canine and the last erupted molar. So as your incisors erupt, the curvoscopy deepens. Curvoscopy has to be 1.5 millimeter in your premolar area. You all know that, but in deep bite cases, like deep bite, especially due to over eruption of lower anteriors, in that cases, the curvoscopy deepens. So the intrafacial clearance is usually normal as the molars are fully erupted. Deep can occur due to infiltration of molars. The presence of lateral tongue posture or lateral tongue thrust may prevent the molars from erupting to their normal occlusion level. So this is the second reason why dental deep bite occurs. The one is the excessive eruption of anteriors, and the second one is like under eruption of their posteriors. So when there is, you see in this first figure, there is no much occlusion in the posterior aspect. In that cases, your anteriors will go maximum occlusion, and that results in deep bite. If your posteriors have erupted well and your anteriors are aligned well, or they're in same level, there won't be any deep bite. But your anteriors are in, like normal level, but there is no posteriors to occlude, then there will be definitely deep bite. The deep bite caused by infraocclusion of molars are characterized by the presence of partially erupted molars. So diagnosis and treatment planning we will discuss in the next class. Okay. Okay, that's all for now today.